Utah, from whom I get calls quite frequently. I will say this, now that the ACA has survived a presidential election, 2 Supreme Court decisions, I'm not sure that any other state will ever get the kind of deal that Arkansas was able to negotiate in terms of the private option, and love it or hate it. Everyone else wants it. If you're in one of the other 48 states, you are asking the question, why didn't we do this? And so, whatever you may think about it, you really are in an enviable position. I will also add that, I have had several questions regarding why Arkansas shouldn't just use the federal exchange at this point. Well, I have a couple of answers to that. Number one is that the federal exchange can do no customization. So if you go to the federal exchange, anything that the task force comes up with as far as reforming Medicaid, the federal exchange will not be able to accommodate that. So you will have to have some kind of in-state exchange to accommodate whatever the legislative task force comes up with. And you'll have to pay for it with state dollars. The second thing I think you need to be aware of is that when you use the federal exchange, every plan that's purchased through the federal exchange, there's a 3.5% surcharge that's added to the cost of the premium. That cost is then allocated across the entire market by the insurers. That 3.5% is not capped. They purposely didn't cap it, and when they said it, they said, we are not setting this at 3.5% because it is enough to cover the cost of running the federal exchange. We're setting it at 3.5% because at the time, in 2009, 2010, it was the maximum the market would bear at the time. Well, they have already indicated that cost will go up. So frankly, if Arkansas is planning on doing any kind of Medicaid reform, any kind of health system reform, you will spend maximum dollars if you decide to go to the federal marketplace, because you will still have to have your own state marketplace, and you will still be paying whatever the federal government tells you have to pay for the part that's not